Oh, good morning. BSRT-3C here, Ryaan Abdullah Gayak. And today we're going to be doing a return demonstration for our ABG analysis. And before starting out, we need to know what is the basic overview. The ABG analysis evaluates gas exchange in the lungs by measuring the partial PeO2, PCaO2, and the pH of an arterial sample. Before going through it, what are these variables? PeO2 indicates how much oxygen the lung is delivering to the blood. PCO2 indicates how much efficiently the lungs eliminate this carbon dioxide, and the pH indicates the acid-base balance level of the blood as well as its hydrogen ion concentration. These blood samples are taken or drawn by the percutaneous arterial puncture from an arterial line, which is your radial artery, brachial artery, and your femoral artery. So what are the purposes? Number one, to evaluate the efficiency of pulmonary gas exchange. Number two, to assess the integrity and ventilatory control of the system. Number three, to determine the acid-base balance of the level of the blood. Number four, and lastly, to monitor the respiratory therapy intervention. For the objectives, it is to obtain a blood specimen for analysis of your pH, PO2, PCO2, your oxygen saturation, and your acid-base balance. And lastly, to aid in management of hypoxic state, therapy failure, respiratory therapy failure, continuous ventilatory assistance, and your acid-base balance, and also your oxygen therapy. So that's it for our overview. So now we're going to be talking about the equipments. What are the equipments needed for this return demonstration? First, of course, you need your patient's prerequisite laboratory request, your doctor's orders, and your patient's data. After that, you need a sterile area to perform the actual demonstration of it and actual extraction of the blood sample. So now, in our ABG kit, we have our iodine pivodine, our pre-heparinized injection 3cc with a 20 gauge short bevel of 1.5 inch needle, and also just in case your 22 gauge bevel with a 1.5 inch needle, your sterilized gauze, your band-aids, your alcohol swabs, and your heparinized solution if it is needed to heparinize, but this one is pre-heparinized, and also your syringe cap in case to cover it up. And here we have our alcohol solution for proper hand washing and hand hygiene, and your bag of ice for laboratory transportation. So now let us introduce ourselves to the patient. So before introducing yourself to a patient, make sure to perform hand washing in order to reduce the numbers of microorganisms and to reduce the risk of any contamination or spread of microorganisms. So after this, we're going to read the doctor's order. It is to obtain pertinent data about the patient. So here it is stated that the patient needs a radial artery ABG analysis for normal checkup. And now, after this, we're going to instruct our patient, tell them the purpose, procedure, and responsibilities. And this is due to the fact that any cause of sudden emotion in the patient, like anxiety, weariness, or confusion, might cause hyperventilation. It might alter with the patient's ABG result. So, Mr. Sian, I'm your RT physician for today, and we're going to be performing your ABG analysis. Basically, we're just going to puncture radial artery, and it's not going to be painful, and it's going to be fast. Are you comfortable with that?
Yeah.
This is in order to analyze if there's anything wrong with your metabolic system and your respiratory system. Is that good with you? Okay, after introducing the patient to the matters, we're going to be selecting the site. So here we're going to be selecting the radial artery. The radial artery is a small artery, however, it is easily stabilized as it is located in the bone groove of the wrist. The percutaneous puncture and the pressure control are enhanced by this anatomical mark. So basically, this is always the first choice, except for the parts where The patient has a history of circulatory impairment of the extremity or cardiac arrest, or it has been punctured so many times. So sir, do you have this any contraindication? Okay, so it is successful. Now, when we're choosing the radial artery, we're going to be performing Allen's test, which is to identify the patency of the ulnar artery. So sir, can you close and open your hand? While the patient is doing this, press on both arteries and then let go. If the skin coloration comes back 15 seconds or less, which means the patient's ulnar patency is good and it is successful for radial artery puncturing. So now we're going to position our patient closer in a semi-recumbent position. We're going to put his arm on on the side, and we're going to slowly elevate it and dorsiflex it using a small pillow. Basically, dorsiflexion of the wrist moves the artery closer to the skin surface, which makes the artery easier to palpate. After this, we rotate the patient's hands until artery is palpable. So it is palpable, and the patient is ready for puncture. So first, the next step to this is to heparinize the needle and the syringe. But for this, it is already pre-heparinized, so we're just gonna prime it in order to make sure that the heparin solution is mixed well. Also, ejecting all the bubbles because the air inside might alter with the result. So now we're gonna be cleansing the patient's site using we're gonna prepare the site and fingers used to palpate site by cleansing it with iodine and alcohol. So now, using the pivodine iodine prep swab, we're going to be in a circular motion outward. We're going to be spreading it in the radial artery of the patient and outwards. After this, we need to dry it out in order to reduce the risk of any local infection or systematic sepsis. Once it has dried out, get your alcohol swab and cleanse the site with the alcohol swab, and also allow it to dry in order to avoid any pain of the patient while puncturing. Removing this color, the bivalent iodine from the site will help the site be more visible and increase the chances of puncturing the radial artery. So after this, we're going to be finally performing the procutaneous puncture of the selected artery. But before that, make sure to perform hand washing again. And put on your gloves in order to take more measure into avoiding any spread of microorganism or contamination. So now, we need to locate the pulsating artery. It is here. And we need to stabilize it by pulling on the skin and creating a bracket of it with a free hand, and because this is a free hand and this is a puncturing hand. So now, here we have the syringe, 3cc syringe with the 20 gauge bevel needle. So now, we need to puncture the skin slowly, holding the syringe like a pencil. Advance the needle slowly with the bevel upward at approximately 45 to 60 degrees for radial artery and brachial artery, while the femoral artery is 90 degrees. A slow gradual thrust will promote arterial entry without passing through it. It is also important to note that the certainty of position is more important than the atrium angle. So now, with the radial artery here, the bevel up, we're going to be slowly puncturing the radial artery Make sure to observe the syringe for any flashback of the arterial blood. If there's any flashbacks, it means you have successfully entered the radial artery. For plastic syringe, you need a gentle aspiration of the syringe. And for glass syringe, flashback occurs already readily. So you need to obtain at least 1 to 3 ml of specimen. This amount allows for rechecking and additional studies if necessary. After this, withdraw the needle while stabilizing the barrel of syringe. This prevents any inadvertent aspiration of the air that can alter with the specimen. After this, recap the syringe by doing this. Or with syringes like this, you can just simply cover this and set it aside. After this, we need to take care of the patient by taking the sterilized gauze, applying pressure to it. You apply pressure to the site for 5 minutes or until the bleeding stops. If the bleeding has persisted, put an ice pack just in case, and it will cause the bleeding to stop. Hematomas following arterial puncture can cause circulatory impedance, discomfort, and predispose to the infection. After this has been successfully done and the bleeding has stopped, make sure to put some Band-Aid on the given site in order to avoid any further infection to the wound. At the same time, make sure to dispose of your items in the proper disposal area in order to avoid any spread of the contamination and such. After this, congratulate your patient and tell them you're gonna meet them outside. So say congratulations for the successful artery ABG analysis data gathering. And I'll be meeting you outside, and thank you for your cooperation, and I hope it didn't hurt. Thank you very much, sir. So after successfully extracting the blood sample from the patient, make sure to hold the syringe upright, expressing any bubbles air, because those air bubbles can alter with the results and might cause an alteration with the results, as I said earlier. After this, seal the needle immediately with the cap or with the needle or the bottle cap. For this one, we have a bottle cap. So basically, we're gonna be doing this and throwing the needle at the disposable area. After this, roll the syringe gently to mix the blood in the heparin, or going like this. Once it successfully be mixed, now we're gonna immerse the blood sample in the ice bag and ready it up for laboratory testing. The use of ice reduces the temperature of the sample to below 4 degrees Celsius and slows the metabolism of the oxygen. A delay longer than 2 minutes will alter the values. After this, we need to label the specimen with the patient's data. Specific information related to the sample collection enhances the accuracy of the analysis of results. Note that the percentage of the O2 therapy, if applicable, the temperature, especially if elevated, and the time of specimen was drawn. You need those information to be written. After this, you need to order and expedite immediate laboratory services, because more than 15 to 30 minutes will alter and not make the test possible. No result for any specimen, even if chilled, can be accepted at that point of time. So that's it for our RD. Lastly, remember to inside out your gloves, throw it at its proper area, perform hand washing, and chart pertinent data. So that's it all for our ABG analysis, return demonstration for BSRT-3C, RT115. I hope you have learned a lot, and thank you very much for watching.